Bismillahirrahmanirrahim. Assalamu alaikum. I am here from Conceptual Medicos, and today we will continue with the diuretics. We have already discussed the carbonic anhydrase inhibitors and the osmotic diuretics. So today we are going to talk about the loop diuretics. As its name indicates, the loop diuretics will work on the loop. They include furosemide being the most common and most important one, the torsemide, bumetanide, and ethacrynic acid. Now discussing the mechanism of action, first we should know about the physiology. Let's suppose this is a cell taken from the thick ascending limb of loop of Henle, and this is another cell having this paracellular space between the cells. This is the luminal side and this is the basolateral side. We have this pump on the luminal side which transport 2 chloride, 1 sodium and 1 potassium to inside the cell. Some of the potassium leaks through the leaky potassium channel back to the lumen. On the basolateral side, we have channel for the chloride ions, we have co-transporter for sodium and chloride, and we have the counter transporter for sodium and for potassium, and some of the potassium again leak to the basolateral side. Note that when these potassium leaks to the luminal side, they will create a positive potential here, and this positive potential is responsible for the push of magnesium ion and calcium ion through this paracellular space into the basolateral side. So the absorption of magnesium and calcium occur by this mechanism. Now these loop diuretics will work on this co-transporter of 2 chloride, sodium and potassium and will block this transporter. So these things will not be absorbed and readily will be excreted in the urine. As there will be ionic disturbance, so the potential here will also be disturbed and the magnesium and calcium will also be lost in the urine. Among the loop diuretics, furosemide not only blocks the co-transporter, but it is also a weak carbonic anhydrase inhibiting activity. Coming to the pharmacokinetic, so these loop diuretics are readily absorbed from the gastrointestinal tract. Furosemide and bumetanide are given IV or orally. Torsemide are given orally or through intramuscular route. Furosemide, when given IV, has rapid onset of action of about 2 to 5 minutes, and due to this characteristic, it is used in hypertensive emergency.